we'll share a few ideas with you on how we think this problem can be managed. First of all, I think this is a national emergency. I think there should be more involvement of everyone, government, private organizations, in dealing with this problem. There should be more enlightenment. People need to know about sickle cell disease. Doctors, not just hematologists, need to be able to know how to handle a crisis. Not just doctors now, but nurses and other healthcare providers. One of the key things with a crisis is setting up fluids and giving fluids, because that's what helped to open up the blood vessels more. As you saw, one of the problems with the crisis is that the blood vessels get blocked, and so the blood flow is not good enough, and so the kids don't get enough oxygen, they don't get enough nutrients to their tissues. Bottom line, education, education, education for the healthcare professionals as well as the public at large. I think also they should make it easier and cheaper to do genotype tests. Now, genotype tests basically tell you whether or not you as a parent are at risk of having a child with sickle cell disease prior to marriage, so that you can know whether or not this is the right fit. And of course, some people, even though they know and they find out that there's a risk, they still go ahead and do it. And sometimes they're lucky, other times they are not. The other problem with genotype testing is that it's not always accurate. If I've heard it one time, I've heard it 1,000 times. That the parents, they did the genotype test, they were both AA, they were okay, and all of a sudden they have a child, and after 2 years, the child is having crisis. And they're like, what happened? They go back to another testing center lab, and then they find out that they were both AS. So how did that happen? AA to AS. It must have meant that there must have been an error in the reading in the prior testing that they did. So there's no foolproof guarantee, but at the same time, genotype testing should be made possibly cheaper and more affordable and more accessible around the nation. It shouldn't just be in the big cities like Abuja and Lagos. Now, so we've talked about two things: education, enlightenment, training, to making genotype testing available. So there are medications that have been made available. Hydroxyurea is one of them. Diascovite is another one. Of course, you have the routine medications like folic acid and antimalarials. Some people even give prophylactic antibiotics. I am not sure about that, because giving antibiotics over a long period of time has its own risks. We won't discuss that at this point. At the Brain and Body Foundation, where we work, we address these things slightly differently, because already these kids are being managed by their doctors. We're not taking away from that. But we say, well, what can be done to improve, to strengthen their bodies, to strengthen their systems, to strengthen their red blood cells, strengthen their white blood cells, so that this build-up that we see over time of damage to the vital organs, the lungs, the hearts, the tissues, the brain, doesn't happen. What can be done to actually stop that build-up? What can be done to reverse that? There are about 4 things that we came up with, and we've been doing that regularly now for about 2 years, and we've had results that were shocking, in my opinion. From simple things that we did, we found out that one of the things was that these kids have really, really low immunities. So think about it. We're in an environment where there's malaria, there's typhoid, there are these infections here and everywhere. Their bodies are burdened all the time by trying to fight these conditions. In addition, children with sickle cell disease, there are 3 things that make their immune systems even more depressed than the average child. So we said, well, what is it going to take to strengthen a child's immune system? And so we began to look, and we got some nutrients. These are all regular nutrients, but they're really concentrated nutrients. We call them nutraceuticals that help to boost and improve immune function. And simply doing that, for instance, has helped in, I would say, conservatively, about 80 to 90% of reduction in crises. In some cases, they just stop the crisis entirely. The other things you can do also to help in terms of Kids, many times with sickle cell disease, they have more what is known as free radical damage or oxidative damage, which basically it means that whenever there's a damage to the cells, whenever the cells rupture, they release these chemicals that cause oxidative stress, free radical damage. These chemicals just damage the lining of the blood vessels. You've probably heard us talk about damage lesions to the lining of the blood vessels. So all kinds of things are going on, toxins especially, that are being released in these children with sickle cell disease. If you can address that, bring or neutralize or remove those toxins, those free radicals, we'll see that these kids tend to feel better, they feel stronger, they have less likelihood of having these crises. Another thing we see is inflammation. When we see these kids have inflamed lungs, inflamed blood vessels, inflamed in certain parts of the brain and other vital organs. A good anti-inflammatory, not the non-steroidals, but nutrients. There are nutrients that can actually act as anti-inflammatories. Another thing you want to think about is vitamin D3. We've talked about vitamin D3 a lot in the past. We black people are deficient in vitamin D3. Vitamin D3 helps to boost the immune system, but it's also good for the brain and the heart and the rest of the body as well. And think about this. We black people are already deficient in vitamin D3. Sickle cell patients are more so. So we need a lot more. These kids need a lot more of vitamin D3. The recommendation, in my opinion, for levels of vitamin D3 that is available to be used on a daily basis, the recommendation, in my opinion, is way, way, way too low. I take up to 2,500 international units of vitamin D3. Anyway,